Hi guys. In today's video, we'll be discussing difference between short rotation and long rotation. What is the difference? So we'll be looking at the following features, and you can also use this thing to know how to answer differentiation question. In differentiation question, you bring the two and you will use features, to write it. You put it in a tabular form. I'm giving you tips. So you put it in a tabular form and you now put what you want to differentiate. You write it down. Here now I'm differentiating short rotation and long rotation. And I'm using these features now, which is number one is rotation direction, the angle of rotation, second one, the third one, common outcome, fourth one, labor difficulty, the fifth one, need for intervention, sixth one, clinical relevance, according to mechanism of labor. So you see that it is not easy for me to differentiate it. Okay, let's now go to the main topic of today: difference between the short rotation and long rotation of occipito-posterior position. The first one now is rotation difference. In short rotation, it is posterior. In long rotation, it is anterior. It rotates anteriorly in long rotation. What do I mean by this? In occipito-posterior position, generally, that is both long and short. The leading part engages in the posterior part of the maternal pelvis, that is in the hind pelvis. The fore pelvis is narrow and the hind pelvis is wide in anthropoid pelvis, and you can also see it in android pelvis. You get? So because of this now, the engaging part, seeing that the hind brain is roomy, we now go and engage there in the roomier pelvis, in the wider pelvis. You get? In short rotation, if it's rotating, it will rotate 1/8 of a circle, and if it rotates 1/8 of a circle, it's still in that posterior area. The hind pelvis, it is still there because it rotated 45 degree. You get? But in this long rotation now, it will rotate 3/8 of a circle. You get? So if you rotate 3/8 of a circle, it will now go to the anterior part of pelvis now of the maternal pelvis. You get? Because that one is a long rotation. It will rotate 3/8 of a circle to the anterior part, that is the front. Anterior means front of the maternal pelvis, which is the fore pelvis, to impinge under the symphysis pubis. See, the symphysis pubis now is in the front. You get? Angle of rotation. The short rotation, the angle is 45 degree, while the long rotation, the angle is 135 degree. Okay, so the common outcome of this short rotation now is persistent occipito-posterior position. Persistent. What do I mean by this persistent? In short rotation, the sinciput is the leading part. So if it now rotates, it is likely for it to engage in the transverse diameter of the maternal pelvis, which is the ischial spine. Opposite side, it is called the transverse diameter. If it now turn and engages in the transverse diameter of the maternal pelvis, the head will now not want to go out. So it will now lead to persistent occipito-posterior position, which will now lead to prolonged labor. And also it can make the baby to be born face to pubis. You get? In long rotation, there is normal occipito anterior position. The difference is just that it's going to rotate 3/8. That is just it. You get? So in labor difficulty, it is more painful. It is very, very painful. That is short rotation. It's painful and it can lead to prolonged labor, because if you now reach that ischial spine, which is a prominent projection, can now hold the head together, and the head will be struggling. It can lead to prolonged delivery. But in long rotation, it is more efficient. So there is effective delivery in this long rotation. Need for intervention, because this one now leads to prolonged labor and persistent OP. Now the need for intervention is very high. You now see forceps delivery, vacuum extraction or vacuum delivery. You now see cesarean section. But in long rotation, it is lower. Clinical relevance. It is linked with prolonged labor, maternal exhaustion, birth trauma. This short rotation, I've given you reason why it can lead to this. For long rotation, it results in spontaneous vaginal delivery with better maternal and fetal outcome. According to mechanism of labor, in short rotation there is no flexion, even though the presenting diameter now is occipitofrontal of 11.5, it is deflexed. But in long rotation there will not be flexion, but in short rotation there is no flexion. That is why the sinciput is just eba. The forehead now will now be the leading part, you get. So, and it rotates 1/8 of a circle. The sinciput will now be the leading part. The sinciput impinges under the symphysis pubis. Why the occiput now? Occiput is this, the back of your head, this place now. The occiput will now be in the hollow of sacrum. The sinciput escape the symphysis pubis, while the occiput sweeps the perineum, and the head is borne by flexion. This is how it occurs. Instead of it to extend like this, now flex. Okay. During normal delivery, during normal, I don't have the model of a fetus. Okay, let me use my hand. Extension, flexion, extension, flexion. This is my fetal occiput or fetal head. Let me use a lay language. So instead of in short rotation, instead of the head to be born by extension, it will not be born in a flexed manner, you get. So that is what I'm explaining. But for the long rotation, the occiput is the leading part. Although the presenting diameter is occipitofrontal of 11.5 cm, the attitude is deflexed. But when contraction occurs, there will be flexion, a little bit flexion, which will now reduce the diameter of 11.5 to 10. The occiput is the leading part, and it meets with the resistance of the pelvic floor muscle. It will rotate 3/8 of a circle to impinge under the symphysis pubis. The anterior shoulder will now rotate to 8. It will be in the right iliopectineal eminence. If you are doing the left, it will be in the left iliopectineal eminence, you get. Occiput now will turn to the right side, that is 1/8. There will be restriction whereby the head that is there, let us say it is the untwisting of the neck, because they are not in alignment. So the head will now turn to the right, so that it will now meet with the shoulder at that iliopectineal eminence. It will turn to the right to go to the iliopectineal eminence where the shoulder is, with uterine contraction again. Both the head and the shoulder will now turn. The anterior shoulder now will now impinge under the symphysis pubis. I've already done videos on this short rotation and long rotation. So after listening to this one now, you can use that practical on to back it up. So after the restitution now, there will be external rotation of the head and internal rotation of the shoulder. Before, the anterior shoulder will escape the symphysis pubis, while the posterior shoulder will shift the perineum, and the body is borne by lateral flexion towards the maternal abdomen. Or also the short rotation, the body is borne by lateral flexion towards the maternal abdomen. So, but we are talking about the difference. The long rotation, the head is borne by extension, but in the short rotation, the head is borne by flexion. Thank you for watching this video. See you in my next video. Make sure you subscribe to my YouTube channel. Bye.